This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh. We're going to be heading up to the orthopedics unit. We're going to be speaking with Dr. Joel Cler. He's a surgeon and he's going to be letting us know the latest advancements in both knee and hip replacements. Thank you for joining us today. We're talking about knee replacements, hip replacements. It's a surgery, it's a procedure that's been done for quite a while, isn't it?
Right. Actually, they first started back in the 60s doing them.
And I would imagine things have progressed quite a bit over the last
Quite a bit.
few years.
Everything has always changed. We always talk about orthopedics, things go in cycles. You see stuff come and you see stuff go. But yeah, it does change quite a bit.
Yeah. Let's talk about some of the advancements in knee replacement. It seems to be a lot of people getting knee replacements either from sports injuries or injuries or just age.
We're certainly seeing that with the aging population and the boomers. They're a lot more active and tended to beat up their bodies a little bit more. We're seeing it kind of back up as far as years go. We're doing it younger and younger. The biggest change in the past few years has been using computers for the total knee replacements. I tried them, and a number of people have tried them in hips, and it's just not that big advantage. But in knees, I think it's still the only way to go. The advantage in doing a total knee with a computer is that the accuracy is better, and you're also doing a customized fit on that knee. That computer. The first thing we do is educate the computer. We show it where the hip is, show it where the ankle is, show it the surface anatomy of the knee, and we end up having a plan that's based on that specific knee. And it ends up better balanced. It ends up with a knee that moves better and that should last longer.
Yeah, and when you're talking about a knee replacement, what are the materials that you're using nowadays?
Well, in the knees, there's two different materials. There's cobalt chrome, which is a stainless steel, which is pretty much the standard. There is titanium out there. Titaniums work wonderfully in hips, but in knees, titanium's a really strong, tough metal, but it doesn't wear as well as stainless steel. So most of the knees out there are stainless steel.
And is there something that determines whether your lifestyle determines one way or the other, which way you're going to go?
Somewhat. I mean, we tend to go with, I use what's called a rotating platform knee. In fact, I've got one here. All the total joint designs out there go back and forth like this, all of them. The knee replacement itself, the bone is still you, ligaments are still you. The replacement is actually the metal and plastic. All the total joint designs out there go back and forth. The rotating platform also rotates back and forth like this. It's a more natural motion. You need to have some rotation when you move back and forth, especially when you straighten the leg out. And this design has some theoretical advantages. If you put it on a machine and bend it back and forth 6 million times, this will wear less than a standard knee. More importantly, this design's been around long enough that at 20 years, 97% of the knees are still in. So it's a knee that lasts a long time, so that's why we use it.
Yeah, and does age then play a factor, or say you're an active athlete, you still got a few years where you can run around the softball field, or you're getting up there in age? Are there differences in surgical styles?
Not as much. There's some in hips. There's some use of a little bit less expensive plastics in older people that aren't going to beat it up quite so much. That's been the biggest change in hips, has been in materials. The standard hip way back when was a hip that looked like this. It's a metal ball with a metal and plastic cup. So the bearing surface was metal and plastic. Well, the trouble with the old generation plastics is eventually the plastic wears out. And plastic particles flow around. The body doesn't like that. And what happens is the bone starts to disappear, and as a consequence, the prosthesis gets loose, and then you have to revise it. So we've always been on a search for something else. What else can we put in that doesn't wear? So again, everything goes in cycles. We went to metal on plastic, we went to ceramics. That didn't work out quite so well. It disappeared and went back to plastics. A little bit ago, probably 5 years ago, we were back into the ceramics and the metals. Ceramic on ceramic is a really good material. If you take a ceramic ball and spin in a ceramic cup, it spins forever. There's like no friction at all. However, it's a brittle substance, it can break, and some of them squeak, and people don't like it when their hips squeak. So that kind of slowed down on the ceramics. With the other material is metal on metal, and I've got a metal on metal ball here, and that was a great idea. Metal and a ball in a metal cup that it has no particle debris. It has some ions out there, and it works really good, except what we found was some people do not tolerate metal on metal ions. And in fact, that was the big recall you see on television all the time, was a metal on metal hip. And that pretty much killed the metal on metal. So now we're back to metal on plastic. And the good news is we're into the third generation of plastic. They're even into the fourth generation, in which they're putting an antioxidant, a vitamin E kind of thing, into the plastic itself, so that the plastic will last a lot longer, and they should last 20, 30 years now.
Yeah, and when we're talking about knee and hip replacements, I mean that can scare some people. The thought of that. Where are we in the advancement of pain control for something like that?
That's probably one of the biggest things in the last couple of years. Traditionally, the way to that we treated pain was with narcotics. You gave somebody narcotics after the surgery, and they did okay. The trouble was it hurts. And the narcotics all have side effects. What they do is you start getting sick with them. They don't breathe as deep as they're supposed to, and they're just not a great solution. What we're going to now is a number of different things. It's called a multimodal pain management system, and we give anti-inflammatories to try and block some of that pain response. We use an injection at the time of surgery with a long-acting numbing agent and anti-inflammatories and some other medications that help block the pain. We're also doing blocks where they put a catheter in alongside the nerves that go down to the knee, that also will block that pain for a good 24 hours. So it gets them past that really bad first day, and beyond that, then they can usually switch over to pills, and they do pretty well.
Now, if you have any questions regarding knee and hip replacements, you can certainly give us a call here at the Aurora Medical Center in Oshkosh at 920-303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.